it looks like there's like over 50 people here right now. There's a lot of emotion, specifically about Southbridge.
We say no to Southbridge.
Southbridge is one of the largest long-term care operators in Ontario, with one of the worst records when the pandemic hit.
Southbridge doesn't care.
Despite that, the province is pushing forward a plan to expand one of their homes here in Port Hope.
Citizen action, Port Hope.
With staggering waitlists for long-term care, the government is determined to license new beds as quickly as possible, even if it means putting seniors in homes that have struggled in the past. I've been inside many Ontario homes undercover in the years before the pandemic. Unable to get answers about abuse, neglect, and understaffing, CBC Marketplace went inside to see for ourselves. The results were shocking.
Oh, please help me, help me.
Basic needs not met.
I think somebody needs help outside.
Crazy.
She's been waiting to use the washroom for like an hour.
And staff overstretched and overwhelmed.
You should be able to go in and wash them from head to toe. That doesn't happen.
The pandemic exacerbated those issues. Many homes were unprepared, and the military had to be called into some to provide care for the residents. By the end of the first wave, nearly 2,000 Ontario residents were dead.
There'll be justice for these residents and their families. We are fully prepared to pull licenses, to shut down facilities if it is necessary.
3 years later, operators with some of the highest death rates are not only still around, they're expanding. Our reporting revealed Southbridge Homes had a death rate more than double the provincial average in the first wave.
Hell no, and say no.
The company plans to build a 7-story building here in Port Hope, amalgamating and expanding their 2 existing homes. But some in the community don't want to see the company caring for any more of their neighbors.
I don't trust Southbridge is going to change.
Jenny Monroe is among those leading the fight. She had looked at the home for her own mother.
Well, I had been in there and I noticed that the nurse or the support worker in charge was really, really exhausted. And I'd also heard from some people who'd worked there that it just wasn't good. And they wouldn't really go into much detail, but I did know that there had been some terrible things.
One of those terrible things was the story of Beverly Haynes. We reported on the massive bed sore on her lower back that led to her death. And in the months and years before, the home had repeated skincare violations. Advocates hoped that COVID would be the catalyst for change. And with the new Fixing Long-Term Care Act, the government promised it would be. During the pandemic, Premier Ford promised accountability for those homes that failed seniors. Do you feel like that's being fulfilled, that promise?
I don't. I don't think that there was any repercussions for those homes at all.
Jane Meadis is a lawyer with the Advocacy Center for the Elderly, and she's been calling for more accountability in long-term care for years.
But I really am concerned that they're not using the tools that they've said that they've put in the legislation.
The province's new legislation includes monetary penalties for repeated violations. A CBC analysis found that despite the ministry announcing new maximum fines of $1 million, most homes are only being charged a couple thousand for serious offenses. Many homes aren't facing any financial penalties, including Orchard Villa, where just this year, there were repeated failures to report critical incidents and violations of infection control rules. Meanwhile, the home is getting the green light from the province to expand in a deal that could pay them millions in taxpayer dollars.
The amount of profit that is going to bring in when they're not actually showing that they've changed anything it's just unbelievable to me. I can't wrap my mind around it.
Kathy Parks' father, Paul, was one of 70 residents to die at Southbridge's Orchard Villa in the first wave of the pandemic. The community here in Pickering, Ontario, is still mourning loved ones they lost. Families believe some died of dehydration and malnutrition from lack of care.
They've had 3 years to make some really significant changes. And when you look at the online incident reports, you see that they just haven't.
The Fixing Long-Term Care Act states that an operator's past conduct should be considered when deciding to renew their license.
They continue to make their profit and behave in the same way, and it's a free pass. But it's a free pass at the hands of people like my father.
CBC reached out to Southbridge several times, but received no response. The military report for Orchard Villa was scathing. And Premier Ford said the day after that he wouldn't hesitate to pull licenses. What do you make of that 3 years later?
Well, it was, hot air. Nobody is saying that these homes shouldn't be built. We're saying that there is a huge problem in the management of the homes. They don't have a track record. And so why are we allowing them to have, millions and millions of dollars of money? A new building's not going to fix poor care.
But the Minister of Long-Term Care, Paul Calandra, is confident that his Fixing Long-Term Care Act will do just that.
We're going to make significant investments, but the standards are going to be the highest in North America.
Premier Doug Ford said during the pandemic that he wouldn't hesitate to pull licenses. How bad does a home have to get before your ministry is prepared to do that?
Look, I have not been shy of issuing, or the inspectorate has not been shy of issuing penalties. We've hired people on and will be up and running by September. We're just training them right now. You'll have fines of anywhere between $200,000 to $1 million for people who are repeat offenders in some of the most worst instances.
Would you want to say anything to those people who are still concerned and don't trust Southbridge?
Look, I understand it is one of the reasons why we brought in the Fixing Long-Term Care Act. And I can say very sincerely to those families, I will hold every home accountable to meeting those very, very high standards.
But until they prove they have changed, Jenny isn't taking any chances.
If they changed, I'd be happy, And, I'd put my mother in there if they really changed. Isn't it beautiful?
Yes.
For now, Jenny visits her mom in a low-rise home in the next town over. Her mom is a national icon, the only Canadian to ever win a Nobel Prize in Literature, Alice Monroe. She wrote many short stories featuring ordinary Canadians facing everyday challenges.
What do you think? Shall we sit under those trees?
Probably.
Yeah, probably.
But Alice has Alzheimer's, which put Jenny in an all-too-ordinary situation, finding a home she can trust with her mother's care.
We need to treat it as a place where they get everything they want. Dementia doesn't take away from who you are on a very deep level. So we need to treat those people with respect.
Respect, some feel, won't come from operators who haven't had to reckon with their past mistakes.
Katie, so that's the situation in Ontario. What's happening in other provinces?
Well, Ian, Ontario is a bit of a unique situation. About 60% of the long-term care homes here are owned by for-profit companies, operators like Southbridge, that own the buildings and are given funding packages from the province to pay for the care. Now, not all provinces are like that. Take Saskatchewan, for instance, where every long-term care home is a nonprofit. Meanwhile, in places like Nunavut, you have situations where care is run by private companies funded by the government, but the real estate, those buildings, are actually owned by the government. So all this to say, the situation in Ontario is increasing calls for a national long-term care plan that would level the playing field across the country.
Katie Peterson in Toronto, thanks.
Thank you.